right, I want to show you the gait belts. And this is a gait belt. Gait belts are used to help patients who are unsteady on their feet. We use the gait belt for transferring and ambulating. Anytime our patient needs just some additional assistance. We do not want to be picking patients up by their pants or under their arms. And so we use the gait belt. These gait belts do up just like a regular belt. There's some teeth here, and then you just buckle it just like a regular buckle. Go next to the teeth and then through the buckle, and then it holds tight. Most of the time the CNAs will be wearing their gait belts, and then they'll take the gait belt off and use the gait belt on the patient. So I'm going to help Mrs. DeBurke sit up, and we're going to be transferring Mrs. DeBurke into the wheelchair. So the bed is an electric bed, remember. So first thing I'm going to do is I'm going to set her up. Up she goes. And then I'm going to bring her around to the side of the bed. And Mrs. DeBurke has had a stroke, and her right side is weak. Her right leg and her right arm is weak also. So I'm going to place the chair at a 45-degree angle next to the bed. Most important thing is that the brakes are on. So just make sure those brakes are on. And probably for the skills test, the only thing they'll fail you on is if those brakes are not put on. So make sure they're on. And then I'm going to put my gait belt on Mrs. DeBurke. We don't use gait belts on patients who have had heart surgery, abdominal surgery, anybody who has severe osteoporosis. But otherwise, we can use them on most everyone. So the belt goes right around the waist. And then we're going to buckle it just like I showed you, next to the teeth. And you want it tight enough so that you can put your hands underneath it comfortably, but not too loose that it's going to slip up the waist. And then you'll buckle it up. And then I'm going to help Mrs. DeBurke sit on the edge of the bed, and I want her to sit here on the side of the bed and dangle. We call it dangling, until she doesn't feel dizzy. So Mrs. DeBurke, we're just going to scooch you up forward just a little bit. And then what I want you to do is I'm going to have you stand on your strong leg, and I'm going to transfer you into this wheelchair. Use your arm here to kind of grab the arm rail, and then I'm going to help you, and I'm going to be holding onto the gait belt. So are you dizzy at all?
I'm not now.
Oh, good. Okay. So the state doesn't really care where you put your feet. But what I like to do is put one foot between her legs and then the other foot pointing toward the wheelchair. And then we'll have Mrs. DeBurke stand on her good leg, and then I'm going to pivot her around so that she can just sit comfortably into the chair. So on the count of 3, we're going to stand up. I'm going to have you put your arm just kind of around my arm right here, and then stand on your foot. We'll pivot you around and you can sit in the chair. Okay. And I'm going to be supporting you.
Okay.
So on the count of 3, 1, 2, 3, and then around she goes. We've just pivoted her around, and she's sitting comfortably in the chair. All righty. And then if she starts to fall down in the chair, you would come around behind and put her arms together, and I'm going to put my arms on her arms. And will you just push with your good foot? Back she goes. Good. Okay, we got her in the chair. Oh, let's put her feet up on the, and I did put her shoes on. She's got her comfortable footwear on. We have to keep her feet covered. Non-skid footwear. Okay, good job, Mrs. DeBurke. Now we'll take you down to dinner.